Good morning. It is council time for Clark County, Washington. Wednesday, November 30 is the date. And today, in an unusual move, we begin the session with an executive session. As you know, we don't like to do this because we like to keep the time that is with the public contiguous so that there is no interruption of the flow, no inconvenience for the public. But this time we need to do it because the content of that executive session is in fact related to some of the business which follows. So this is in accordance with RCW 42.30.110 section 1G. It will be for a 15-minute period. Council will be present. And Leslie, is there anything else that should be added?
No, that's all. Thank you, Chair.
Okay, very good. And for the counselors, I will see you now in executive session. Good morning again. It is Wednesday, November 30, 2022. We called council time to order at 9 a.m. and then recessed into an executive session for 15 minutes, and that session has now been completed. So we move to the first item on the regular agenda, which is public comment. If anyone wishes to comment on an agenda item, meaning something that is on the agenda for council time today, we welcome your comment, whether in the hearing room or online on the phone, any way you wish to give us the feedback. Staff, do you see any people who are interested in testifying?
We do, Chair. Caller, you are unmuted now if you want to go ahead with your comments.
Yes, this is Kimberly Elba, and Clark County resident for all my life. First, I resent the criminal trespass letter I received on October 26th, and I'm pursuing action. It's important that Chair Barrowman and Medicine Man Melnick attend all meetings in person. Also, you're going to be inclusive and with equity and make it evident that you follow the Constitution. So approving the minutes of November 16th, I noticed that no citizens spoke up or made an open public comment. I'm going to say now that my understanding a few weeks ago when I went online to view council meetings, the message was no meetings for the rest of the year. Yet this and another meeting took place, and that's why myself and others did not make comments. I hope you'll address this after I'm done speaking. The public safety sales tax is not transparent in its description to the public. Also, I want to take note that on the website under how to participate in council meetings, your letterhead there has Eileen Queering O'Brien as chair. Maybe you guys could change that also on your website. I hear you're having troubles this morning on the website, and I've complained about your website and how untransparent it really is. It's very hard to navigate. So I could not find the phone number. I had to call Rebecca this morning, and she graciously gave me the phone number and passcode. So on the number 2 item for how to participate, to join by phone, of which I'm forced to do at this council, as this council has given me a criminal trespass letter on October 26th, dated September 14th. I've asked numerous times with no answer as to why you illegally have taken my freedom to assemble and suppressed my in-person First Amendment rights. This will be rectified soon. So I call in and I got that taken care of by Rebecca this morning. To me, it's very disturbing, if not breaking the laws for public disclosure and the Washington State Public Meetings Act, possibly criminal and definitely unethical practices directed towards citizens who want to speak up and participate in our local government, which is sliding down the slippery slope of socialism and Marxism. So as far as your WCMA and the ICMA, I believe that they are on the same level as the membership that the Vancouver City Council has of the United Nations entity called the ICLEI. I believe that the WCMA and the ICMA are also, you guys are following it because you're a socialist state right now, and we the people are not going to have that with all this activity you've been doing basically through this last 3 years of the pandemic. So it's with the global trends and one world order ideology. You, on your
And we have reached the
report,
end of your 3-minute
non-elected
time
official.
period. So I will ask that the next speaker be allowed to present. Kathleen Otto, is there anything that you wish to add regarding criminal trespass letter?
I can just share that there will be communications today with Ms. Elbon from me, and so I anticipate I'll be sending her some information by this afternoon.
Okay, thank you. And staff, are there any others wishing to testify?
No, Chair, that was all.
Okay, very good. We move to old business 3.1, which is minutes for November 16. Is there a motion, please, for approval?
Motion to approve, Madam Chair.
Second,
Second.
discussion, edits, changes, anything? Hearing none, they stand approved as drafted. Let's move to item 3.2, the public safety sales tax.
So good morning, Council. As we mentioned in the past meetings, we were going to come back and talk and discuss with Council the public safety sales tax funding and potential options. I know Mark Gassaway is online and Sheriff-elect Horch is in the room. I'd invite him to come up and join the discussion this morning. This spreadsheet in front of you is one that you have seen before. This was drafted by Mark Gassaway when we were considering going out to the voters. It shows the revenues and potential expenses with regards to the public safety sales tax funding that we'll start receiving in early 2023. At this time, I would like to have Mark actually go over the different components of this, and then after that is done, of course, the council can ask questions. And then I'd like to invite, again, Sheriff-elect Horch to participate in the conversation and share his vision on the body cameras, which is one of the mandated areas in which we'll be funding from this tax. So with that said, Mark, if you're available.
Thank you, Kathleen. Just a sound check, thumbs up. We can, great, thank you. This model was created, as the council knows, to try and help us understand what some of the uses of the public safety sales tax could be. Now, I don't want you to get hung up on the numbers. It's a model. We can certainly change the numbers based on what assumptions we want to adopt. But these are just examples, and some of them are placeholders for some of the expenses that have been talked about that we would use this public safety sales tax for. If you look down the left-hand side of the model, you'll see that right at the top is the body camera program. Again, don't get hung up on these particular numbers. We know that that program is in process. We're right now in the process of looking at vendors, selection, what the resources would take. So again, based on those assumptions, we'll be able to fine tune the numbers. But certainly this was one of the top priorities for the public safety sales tax. Down below that, you see the Clark County Sheriff's Office Deputy Program. This would allow us to increase the salaries for our road patrol deputies. Below that is a placeholder for the corrections program. Again, looking at the salary piece of that, possibly adding new corrections employees as we go through the remodeling process. Again, all certainly acceptable uses for this fund. Then below that, the last piece is the capital facilities, M&O, which we could use to help support the changes in the jail or other facilities throughout the county. So again, these are just examples. all of these amounts are just kind of placeholders at this point. It kind of shows you the level of expense that this fund is able to support. So that's kind of a brief explanation. I do have one comment on this particular version. You can ignore, there's a footnote 7 that was put in place in the event that the sales tax had a 10-year cap. We clearly don't have that at this point. So just please ignore that footnote 7. The model takes into account a continuous sales tax even past year 10. So I'm happy to answer questions. Again, this is a model. We're able to certainly make changes to it. These are just estimates or placeholders at this point. We know that the exact numbers, as we get further down through the process of the body cameras, we'll have better information there. If the decision's made as far as the salary increases for the deputies and for the corrections program, we can plug in exact numbers and show you what that would look like. So that's where we're at with this, Chair. I don't know if there's any questions or.
And if I can add just really quick too, as you can see at the bottom, the annual excess, there is some capacity to look at other funding options. One potential one could be Superior Court staffing, indigent defense, if we see a need as we talk about that program moving forward. And there's also ways, that we can look internally with current staffing and salaries to maximize the use of this fund and potentially relieve a little pressure off the general fund. And then Mark, can you clarify what FTE count that you have incorporated in this model for body cameras?
Yes. So this particular model, and again, this would assume a full year of body camera operation once it's fully built out, which we know it will take time. We will have to get it started, and then over time it will become a full-fledged program. This particular model has the assumption that we would need 12 new FTEs to support the body camera program. That would be a combination of IT support, public disclosure support, program support, probably support in the PA's office as well. So those 12, they don't have a specific assigned department, but they would be used throughout the county. And those numbers basically came from studies that we were able to find from other departments that have implemented body camera programs. And so again, maybe not exactly what Clark County will need, but the best information that we have to work with at this time.
Questions from council? You know what? I'll just begin because I've got a really, really basic one, Mark. This tax, as we know, is a 60-40 split between the county receiving 60% and the city's 40%, depending on population. And I just would like you to clarify for all of us, is this only the 60% that comes to Clark County? And then secondly, would you give some definition to the word margin down there at the bottom in blue?
Sure. Yes, this is only the revenue that will be received by the county. We don't program anything in for the cities. They have to make decisions on their own what they're going to use that funding for. And then the margin down below, that's just, again, it's just a percentage of how much we haven't programmed into expenses based on the model. So for example, in the first column for 2023, that 11.3%, that would mean that with the assumptions that we've made in 2023, we've only programmed about 88.7%. So I would hesitate, again, this is my conservative nature, to program 100% of every dollar every year. That gets us in, into the area, well, what if we don't, achieve the sales tax growth and things like that. So you can see that we've not, for modeling purposes, I have not taken this up to 100% of the revenue for each year.
And I anticipate we're going to develop a fund balance policy for this fund as well to ensure continuity of operations in the event that the sales tax gets hit.
Absolutely.
I have a couple of comments and one question. So first of all, I'd
Councilor
like to,
Mifji.
yes, it is. I'd like to first recognize that the sheriff-elect is here, sitting at the mic. And so one, I want to assure the public that we are working together and we are unified in our approach to make all of our services in the public safety area. We're all rowing in the same direction. We all want to make it better. And if not a model for the state, maybe a model for the nation. That's my goal always. So I thank John Horch for showing up. I know these are our best forecasts, not only on revenue, but also expenditures, and I'm hopeful we can work on some efficiencies regarding the body cam, dash cam, Public Records Act. That's one area that Kathleen, the manager, has been working on for over a year, if not 2 years, on trying to streamline that for the entire county, so we can see some FTE savings and better work product for the public. Also, I just want to comment, I mean, how much more transparent can we be with the public? I mean, every time we've discussed the public safety sales tax, it's all been in public. There's no one present today from the general public, but I mean, these numbers are the best we can come up with. We're showing policy direction on what we'd like to see it spent on, everything from body cams and dash cams program to start with, as well as capital investments and operations and management, getting salaries to a better level for all of our corrections and deputies and admin within the Sheriff's Department. I mean, we're being as transparent as we possibly can. I don't know how we can do better. I know our webpage could always be better, but we're being as transparent as we can as we put flesh to the bone. My one question, though, for Mark is, you know, we had one city actually vote against this public safety sales tax. They didn't want it to be on the ballot, evidently. They didn't support it. And I'm just wondering if there's any way, if that's still their position, where we could recapture their portion of the 60-40 split. I'm just, I know I can see you smiling and laughing, but you know, if they're really against it still, I'm wondering, is there a legal mechanism for us to just scavenge that money and keep 100% that would have otherwise gone to that one city?
Yeah, that would be, I can't imagine that happening, but we can ask them. They could always send it over to us and transfer it if they don't want it. By law, there's nothing we can do. It will automatically show up in their Treasury Department. They don't have a choice.
Are there
Madam
other
Chair?
questions from council for Mark?
Yes, ma'am.
Go
Yes,
ahead,
ma'am.
Councilor Lavender.
So thank you. I just want to say that I think this is really useful information for the incoming council. Be an opportunity for them to hit the ground running, understand what their projections are, and have substantive discussions about FTEs, allocation of funds across the board, whether it's for the Sheriff's Department, other elected departments, the jail, et cetera. So I think having this up front is a great opportunity for them moving forward into 2023.
Agreed. Hearing no additional or seeing no additional questions just yet for Mark, I'd like to turn the mic over to Sheriff-elect Horch for any comments that you wish to make.
Do I have to hit the button? Okay. Can you hear me? All right. Thank you. Good morning, everyone. Good morning,
Good morning.
counselors. Thank you for this opportunity. I know we've been discussing this for the last few years. Mr. Rylander wasn't in on some of those initial ones, but we've been talking about body cameras for a while now, and now we have a revenue source. And thank you, Councilor Medvigi, for those comments. I do believe we are working well together and moving forward on this position in public safety. So that's exciting to see. Now we have funding available, and we've been looking at it, and I just would like to comment, Mr. Gasway, I saw his projections a week or two ago, and he and I haven't had a discussion yet, but I look at it from an operational standpoint, and obviously budget, he's looking from a budget standpoint, and I would concur in the ballpark that he is correct on those numbers. When it's fully implemented, we could be looking up to that many. That is true. I will just tell you what my plan is as sheriff is going to be with body cams. If we're going, and I assume we're going to keep moving in that direction, is the rollout will take about a third and a third and a third to implement. And so when we get an FTE person in charge of this program, we can even start, I believe, ordering some of the equipment this year if we pick the vendor, and I have to talk with our civil department to make sure we're doing everything correctly. But if we can start ordering that equipment, I foresee in next fall of putting out approximately 50 cameras, the following spring another 50, and then the following fall or winter another 50. It's roughly about 150 sworn personnel, and that includes the sheriff as well, because I'll wear one as well. Because I drive a police car in case I do a traffic stop. So 150 total for the sheriff's office. And the jail is another question. I know Mr. Shook is here. We can have that discussion. You guys can have that discussion later. So that's the plan. Is it probably take about a full year and a half, 2 years to implement it completely. So we don't need that many FTEs immediately, but we are going to need some to start. PDR is one of the main issues, as everybody knows, and the IT support. I will say I work with the City of Vancouver, Assistant Troy Price, had discussions with him and Chief Maury, and the IT component is a little bit bigger than people expect initially. So it is something just to be aware of getting this done right, because it is a big project. And when it started 20 years ago, putting a camera on somebody and hitting a button and it recorded, that's what it was. But there's a lot more to it now, especially with public disclosure. So I am asking that the council keep moving forward with this, with the FTEs and the authorization to start buying the equipment. I know that there's a vote next Tuesday, I believe, or Wednesday, to put some of this in motion. So I am asking the council to continue with that. The public wants this. The deputies want it, law enforcement wants it, I believe our county government wants this. It helps with transparency for everybody, and it helps, our civil attorney will even say it can help clear up a case very quickly sometimes. We can look at training issues. If we look at a video and we see, hey, our policy or training needs to change, and it's an officer safety issue too. What they can do with body cameras is a huge improvement than it was 20, 25 years ago when they started. So all these things are good, but it does cost, as you saw that. But we have had the public speak up with this public safety tax. So I'm in favor of this 100%. I've been pushing this, and now we're in a position to move forward. So I like to move forward with it. Do you have any questions?
And are there any general questions or comments from council on the public safety sales tax?
The only question I would have for the sheriff-elect is if it rolls out smoothly, especially that first third, I'm assuming you'd have the flexibility to roll it out and build it up even more quickly if everything goes as smoothly as you anticipate.
Yes.
So that it wouldn't take a.
That would be the plan. I always try to give a conservative estimate, for glitches and training. And so that would be the plan. If we put out 50 and we can get another 20 out the next month and it's not an issue, then we'll absolutely do that. I'm not stuck with this, but I'm just trying to give a realistic expectation and looking at other departments and what they've had to do. So, but the City of Vancouver, if we end up going with some of the same equipment, we partner with them on a lot of things, and Camas, I believe, has gone to body cameras as well. So it's good that we have these examples here, so it should go smoother than if we were starting it up brand new as the first one.
Thank you.
Thank you.
And there is some concern on how quickly they can deliver the body cameras for supply chain.
There is. We've discussed this as getting the equipment. I mean, the equipment is relatively inexpensive compared to the FTEs, but if we're able to order some of the equipment, if we decide, I know we have a month before the end of the year here, we have just December, then the possibility of getting some of the equipment in by April or May is good. If we have to wait till next year, that we could get delayed till summer or fall. So we can have our policies and procedures in place. We can have some of the training in place, but until the cameras come in, we can't implement them. So we're working on that right now with the vendors to see how fast we can get at least an initial set of cameras. However, we still haven't landed on a vendor. I want to make that clear here. We still need somebody in place to finalize the process of picking a vendor.
So one question. Once you've selected your vendor and you've started your first order and you've got that gap when you're waiting for the first block of units to show up, but you know you're going to use, do you have any access to equipment from that vendor that you could actually use in a training capacity to help reduce the time between when you place the order and when you're starting to get them?
That's a good question, and let me explain. We have test-driven several vendors, and this is one of the ones that we're looking at. We've looked at, I believe, 4 different vendors a year and a half ago, 2 years ago. So we've tested, and they're very, as vendors are, they bring equipment, and I don't think there'll be an issue there to come out, maybe start that initial training. But that's a good question. I don't think we should have this huge gap. I believe that they would want to come out and help us get going. And maybe we can piggyback if we select the same vendor with Vancouver Police Department. So.
Kathleen, I have a question for you, and that is, what is the next touch with the Public Safety Sales Tax and Council? And secondly, will there be a presentation by the vendors to Council? Or by a vendor to Council?
I can work with Sheriff-elect Horch to see if that's, as they go through their process and select a vendor, to see if they would be want to come forward and talk to Council about this. I would assume that the next step is for the Sheriff's Office to get their management in place of the program so that they can develop, how we're going to move forward. We do have funding set aside already for the purchase, so that is not going to hinder their process. The only thing, and I'll work with legal on this too, is if Council has to approve the contract with whatever vendor is selected. So that, I think that's the immediate step, and then as we solidify the time frame, we can update this model with more real numbers, and then also looking at, other positions if needed. So we've got some time. We don't receive this funding until the first quarter of 2023, but we can, since this is our last council time, I anticipate the first week in January, we'll be providing an update on where we're at on the program, and the newly elected sheriff will be joining us and taking the lead on that.
Anything else? Okay, thank you very much, and thank you again for being here, Sheriff-elect Horch. We appreciate that. Let's move
Chair,
to
Chair
the
Bowerman.
jail. I'm sorry, go ahead.
Chair Bowerman, I just wanted to point one thing out. I think some of the information that is on here, some of the placeholders will be coming back in the 2023 budget request. So you're going to see that, and you'll have, again, opportunity to ask questions on that. For example, the body cameras would be budgeted in this fund. In addition, there'll be other, items that will come back to you that will be part of that budget process that will come back. So just so council's aware that this is, again, an example and a model, but you'll actually be taking some budget action on this next week. So
Very good. Thank you for that, Mark. Okay, let's turn to item 3.3 on the jail update.
I'm going to turn the jail update over to our Deputy County Manager, Amber Emery, and the Director of our Jail Services, Dave Shook.
Good morning, Council. Amber Emery, Deputy County Manager for the record. So we have been busy these last couple months with the Sheriff's Office. We had an update last, I think it was a couple weeks ago, on our progress. So I'm happy to report the budget process has been completed with the Sheriff's Office and the new Jail Services Department, with the support staff as well as the corrections deputies, and that will be in front of Council for the December budget to approve. So we have completed that, so we're ahead of schedule on that with the sheriffs and our timeline to get that completed. And as far as the operational pieces of where we are with staffing and some of the pieces we've been working on with the sheriffs and the team over in the jail, I'm going to hand that off to Director Shook to give our update for that.
Good morning. David Shook, Director of Jail Services. Thank you for having me here to provide a little update. We've been super busy the last 6 weeks that we've been around. So we're finalizing some of the touches on actually creating a new law enforcement agency. You would be surprised of all the things that are required. So through the state, a new ORI registration with CJTC, which is the state training committee. We're working with the Sheriff's Administration as well as Sheriff-elect Torch with different processes and different aspects of separating the two departments. IT has over 100 different apps and other programs that are connected. And so, as you could imagine, that is a tedious sometimes but necessary process that we're currently working through. We're in the final touches of creating a new badge and shoulder patch to identify different employees and where they're working for the county. And initially, just some current staffing. We currently have 32 vacancies. We have an additional 8 members on light duty or some sort of leave. So 40 out of about 147 staff members that we should have. We have an additional 5 that will be leaving here in the middle of December, moving over to enforcement here at the Sheriff's Office, and another 10, I believe, that are interviewing to move over as well. So we are concerned about staffing. You've heard that over and over, staffing, staffing, staffing. Some of the things that also creates is how we manage the facility itself. So we are turning every stone upside down, trying to look at every operational aspect of the jail, trying to find efficiencies where we've never looked before. So whether it's command and supervision going into different work areas and stepping in for hours at a time to help fill the need, or whether it's evaluating each of the inmates that we currently have. As you know, the fluctuation of inmates is something we can't control generally. We were 411 yesterday, back up to 432, I think, this morning. 450 is a general number over the last 2 months as I've been paying attention. So as we continue to work with our criminal justice stakeholders and partners, trying to figure out how to make this system more efficient. So what are we doing for some of those missing staff members? Another issue that we actually have is we don't have enough female staff members. We don't have enough members that actually carry guns, and so when we have to take inmates to hospitals or to court processes, it really restricts how much of that we can do. And historically, we've relied upon sometimes enforcement at the county. Sometimes we've relied upon the city of Vancouver to come in and do strip searches or pat downs of gender similarities, so that you know, those are some constitutionally and case law required things that we have to do. So we're trying to work through each of those issues. And at times it's very, very concerning for the managers and I on how we proceed beyond January 1st. And so some things that we're working on, and I think HR Manager William Winfield will be talking about that, which is creating some incentives for gender-specific callbacks where we can request employees to come back because we have a specific need, providing additional staffing through temps and hiring honorably retired criminal justice employees that would want to come back and fill in some of those non-traditional inside the jail positions, but hospital security or court security and things like that. Moving some of the inmates that have been in our facility for 200 plus days, trying to get them through the process. So currently we only have enough transport staffing to do 2 courts a day. Well, I want to have more staffing so that we're not holding the judges and the prosecutors and the defense bar up with getting cases resolved. So finding some of those temporary staff to help resolve some of those things is a critical area that we're working with the guilds as well as HR to come up with some solutions. Let me see. Security inside of the facility, and just so you may or may not know, we have 4 maximum areas. One is dedicated to females. One is dedicated to inmates with high mental health issues and other things that need to be isolated or at least have more care and custody to them. And that means we have 2 facilities or areas where we put most of our high-level criminals. And so we are getting a much more prison-like setting. So 2 months ago, we had a stabbing where somebody had created or developed a shiv. And of course, inmates, they aren't cooperative sometimes because they're going to have to live where they're staying, and especially in our facility. Nationally, 80% of facilities are what you use, and then you usually use 20% to manage your inmates and moving them back and forth. So that you can use discipline, you can use aspects of inmate management to control negative behaviors. Because we have 400 plus inmates and literally 364 beds in our main facility, we have more inmates and we can't do that. So we're limited on some of those management things. And so as I continue to learn and as I continue to share some of the issues that Sheriff Atkins is running into, that we will run into, that previous sheriffs will run into as we continue to manage this, when we hear comments like, well, we used to have 800 inmates. Well, again, we used to have a jail work center. We used to have other things that we could use. We don't have that today. So our focus is in getting new employees. We had 12 new applicants, I believe, from a hiring event last week, but sometimes those are 50+% that do not make it through the process. So that hiring and training, it takes a significant period of time. You can estimate somewhere between 9 months and 12 months for a brand new recruit to get functional solely on their own so that they can go out and take up a mission spot. Laterals we've talked about, trying to find some laterals from other agencies. As I'm talking to different folks around this region as well as in Oregon and other places, the support financially that this council and this community has provided for being an attractive hire of choice or an employer of choice is significant. You know, we're competing with the cities around us and our own enforcement branch. So again, continuing with that support is critical for us to become that agency of choice in the corrections profession. Let me see, just make sure I had our staff. So currently, those numbers of staff I just shared with you, we have day shifters. They're averaging about 130 hours of mandatory overtime. So that 130 hours for day shift, we've got our swing shift that we just hit 217 hours for a couple of them. And the rest of them are getting real close on our swing shift. Our graveyard are in that 150 to 160 realm. So what does that mean? So if they're working 12-hour shifts normally, and we're adding on an extra 4 hours because that's all we can add on for safety reasons, they've worked more than 50 extra days with that extra 4 hours. So it's not every day always, but sometimes it's their entire 4 days of the week that they're working. So we try not to touch them when they're on off-duty stuff. We do have some employees that love the overtime and the money associated with it. I have one employee that's over 1,000 hours of overtime, and that's by choice. So for me, that's not a good work-life balance. And so as we continue to look at that, that's burning about $300,000+ a month in overtime costs. And so again, as we look at positions, more positions, less than the overtime costs, which we're not able to plan for generally. And that's a place where we're focusing on operationally, trying to find operational schedules that will help us to eliminate the high levels of overtime and use overtime more as a tool and not a management style. So that will be definitely something that will take a few months to get underway. And just to remind everybody, not until January 1st do we take over the operational aspect of the jail full time. And so, again, I know I've rattled on for a few things though, but staffing and security are our two priorities. I'm sure they're the priority of the current administration, but they're definitely going to continue to be ours. And I look forward to updating you those on as we move forward. So, any questions?
David,
if I
would
can
you
add one more
please
thing, Chair?
I'm sorry, whoever that was, go ahead.
Sorry, Chair. I just wanted to add one thing real quick. This is Amber. Of just how proud I am of Dave and Brian and Joe of hitting the ground in this last month and a half. You know, like as Dave mentioned, we are not in operational control of the jail, but the amount of work that's been done to lay the foundation so that when we do take over control operationally January 1st, we're hitting the ground running with a lot of these enormous challenges that you've heard Dave mention today. So I just wanted to mention that. Thank you.
And I do have some questions when you are ready, Madam Chair. So first of all, wow, got a lot on your plate building this new department, and I understand the the administrative function of getting the credentialing lined up, and hopefully our goal for better mental health care and maybe even getting a licensed facility in there. A lot on your plate. What I want to focus on is two things. One that you brought up that I hadn't really, didn't really have visibility of. Let me start on that, the overtime. You know, having been a manager of people, of workforces in austere and demanding environments deployed with soldiers, you know, I understand that there's always going to be people out there that want as much overtime as they can get. That's not a healthy thing. And it's got to be managed more closely. So, you know, it's not only a quality of life issue for them. I mean, you're not their individual father or mother in management, but it is an individual function that needs to be managed because it ultimately is a personal safety issue. There has to be mandatory downtime. I mean, and Congress mandated it for our professional pilots in the country. You know, you have to have crew downtime for their own safety as well as the safety and decision-making quality that goes on. You know, 12, if anyone's worked 12-hour shifts, I've worked 12-hour shifts, I've worked 18-hour shifts. You know, at some point, you don't function anymore.
That's correct.
You may be there getting overtime pay, but and filling a vacant spot, but you're a hazard. Mm-hmm. So I would ask you to really look very carefully at that. And I realize how hamstrung you are. You're not just getting a new department in whole that you're getting credentialed. You're getting a department that's got a significant vacancy rate. So that's what I wanted to focus on. It's good to hear that you've got 12 applicants, and I know many of them will fall away, but you've got 30 plus vacancies, and that absolutely has to be above all the goal, to fill those vacancies. So branding, I know the Sheriff's Office just came up with a great video. I haven't seen it out in the community. I don't know how it's being marketed. But branding, and obviously the goal is, you know, for every vacancy, you have 3 or 4 applicants, not the opposite. And it's an incredibly demanding market right now. I mean, none of the armed services met any of their recruitment goals in the last couple of years. I mean, it's Taco Bell's having trouble getting employees. Everybody's having trouble getting employees. I don't know where they all are, but so can you give me a little detail on what you're doing for branding, for marketing? What was this event that got you 12 applicants, and how do we expand that about tenfold?
Yeah, actually, that was a combined event with the Sheriff's Office and PST, which is the testing group that we use, that we contract with. And they do them regionally. They do them statewide. I believe Vancouver's down in Oregon City this week or next. So the Sheriff's Office recruitment team was there. We had some jail staff, correction staff were there as well. And as we continue, when you're hiring law enforcement, that's something oftentimes you'll find individuals that want to travel for. I want to go work here as a police officer or there as a police officer. But corrections is a little bit different, right? That's regionally sometimes. That's not as I'm coming from Florida to Oregon to work in a jail. It's just not the exciting thing that it is for corrections. So we have a page already that the Sheriff's Office had previously created. We're talking with our own communications team here at the county, trying to figure out how we can move that branding. It was a pretty exceptional branding and changing of the website and other things. And so we're just trying to make sure that it's pointed differently. We want to help support enforcement in the Sheriff's Office as a whole, but I want to focus and prioritize on correction staff because it's totally different. And so some of the things that we're talking about is new recruiters getting out to different communities. We have a light duty individual right now that is solely focused on making sure all of our literature is up to date with all the extra information, all the increases that council has approved, and making sure that we're identifying the groups of folks. I've recently been asked to be a part of Cascadia, the tech center, so that we can be a part of some of those partnerships. I already have a commander that's over there being involved and looking at our groups of opportunities and candidates, and where do they come from? Whether it's JBLM up north or whether it's sports events around here, it's Christmas time, being at the mall, finding some of those different places where we don't normally advertise. We have to be more active versus passive with our recruitment efforts. And so again, I have a commander, 2 sergeants, I believe, and 3 deputies that do it as a part-time, but I want to look at trying to make that more of a full-time. But again, with that balance and all those other employees that you've talked about in that work-life balance, it's really hard, right, trying to do that. And so that's where we're focusing on the branding. We're focusing on getting out to the different community events and making sure that as we separate from the sheriff's office, it lessens the requirement for civil service, and not wanting to lessen the quality of employees, but be more agile in our efforts to recruit, test, and get on there. We just did a demo with an application where they're being very successful around the country, and it's where you can see the QR codes and instantly you're online with a recruiter. So again, we're looking at some of those modernized current employee groups or applicant groups to try to be more effective in the branding and the attractants of becoming a correctional professional. In fact, most people that showed up to the testing, it was 2 Sundays ago now, said we didn't even know about corrections, right? And so again, not an issue for the sheriff's office, but didn't even know that's a profession or an opportunity. And so we've got to make that more of an event. And so again, it's when we talk about law enforcement, mostly it's enforcement on the streets. But the jail is critical for this law and justice system we have here. So we've got to get the staffing to make sure that we're a healthy facility. So those are some of the things. And if you have any suggestions or other places we could get to, I'd love to. My wife, she's handing out cards every day to people and their grandsons and others that might want a new career choice. So.
Great.
I have a question.
Yes, sir.
Go ahead, Counselor.
I want to be careful in my choice of words. I'm going to use the word profile, but I don't mean it in a negative manner. But I would assume that whether it's in corrections or deputies, et cetera, that there is a certain profile of people, certain mix of life experience, education, a number of different other factors, personality factors, et cetera, that are defined that tend to be the most successful within that branch. So I assume that what you have is a kind of an outline or a profile of the type of persons, male or female, that would be drawn to or potentially do well, and that you then use that profile to go out and seek those people in the community. Is that a reasonable assumption?
As we use profiling usually in a negative sense, there are opportunities to do that. However, I wouldn't want to scroll our way into just a profile, because law enforcement today is more complex than it's ever been. We're asking our law enforcement professionals to do more today than they've ever been asked to do. The mental health on the street, all those other issues. And as we look at our jail facility, while, yes, we need the control and the safety and the security part, we also need the empathy, and we need some of those other aspects of good management of the criminal justice system. And so, yes, we have the military, paramilitary organization, right? That's what we are. We have the colleges that we're out to. We're out talking to even the high schoolers coming up to see, are they applicable or candidate applicant, quality. And maturity is important. When I first applied at 21, I was told, sorry, you're too young. We're hiring at 26 right now, so come back in 5 years. So again, is the level 18 because we don't necessarily have to carry a gun? Is it 21 because that's a requirement? We're talking about all those things, and as I'm able to now have more access, where I came from before, we looked at psychology tests of applicants and to find the ones that didn't make it, so that we could look at the ones and go, okay, well, these are red flags and we should know that, but they're generalities and you can't hold that against everybody. But there are things where you can go then, hey, we should focus on these issues. And so, yes, I think that's important when you look at the entire recruitment picture. Is we don't want to just be stuck in one area, but we want to be able to open that up because of the complexity and the newness of much of it. And as we talk about the future programs of reentry and mental health, we have some exceptional deputies that started as jailers that are really having an exceptional time being part of the mental health component, right? And so again, they're doing their jobs as jailers, but they're working with folks that are experiencing drugs and mental health, which will be a much larger picture as we move forward with this jail facility. So I hope that answered your question a bit.
David, I really appreciate the level of honesty and the depth with which you presented to us the incredible groundwork that you're laying now. It's really quite something. There was one particular stat that kind of grabbed me, and that was the time that it takes to onboard an interested new applicant or a new employee. And that time period is mighty long right now. And that is a problem, as I would see it, for those who are prospective employees, as well as for our own organization. If there is ever anything that council can do to help you shorten that period and move it along, I am sure that we would be interested in knowing about that and hearing about it so that we could support it. It is to everyone's advantage when that process is well done, but also efficient. And I know you know that. So that's where we are.
Thank you, Chair. Thank you, Chair. I guess what I would tell you as far as support that way is the process before we actually have them in a house and their day one employees is somewhat dependent on them, the medical staff, the psychologists, their schedules. And so just having a big enough portal of contracted vendors, right? So enough psychologists. Hey, I'm 3 weeks out in a psychology test. Okay, well, that's too far. We need to get them on board because when Vancouver is hiring as they quickly can, they snatching them up in our midst. I know enforcement is dealing with this right now. So it's making a quick process, and Chair and councilors, I know Sheriff-elect has been working on this for a long time. I look forward to also kind of blending together to continue to work together with some of these efforts. But again, it's really making that method seamless and quick so that we can make hiring decisions. We've also made hiring decisions, not at this agency, but where I previously worked, that were in error because that initial view looked like an exceptional employee. And I don't want to stop that vetting process because I would rather hire the right people than hire the wrong people and then learn from it months later. So again, there's really a good balance as far as that goes.
And Madam Chair, based on something that was just said, I'd like to make an additional comment, especially with the Sheriff-elect present.
Councilor.
Yeah. And it's part of branding. And obviously, we don't want the sheriff always poaching from corrections. But boy, what a great working relationship we always need to have. Of all the chiefs I ever met and sheriffs I've ever met and worked with, you know, they all pretty much universally say, man, when I have a deputy that's had corrections experience, they've had a head start because they learn the culture of the street in a safe environment in a correctional setting. So, you know, this working relationship and the career progression, if you will. I mean, corrections can be an entry point for other professions within policing, whether it's in a local sheriff's department or police department. So I want to make that clear that I'm really hopeful that you guys will keep doing these joint events and keep working together and leverage one another. And having said that, you know, that part of the branding is, you know, corrections is a profession itself, and we hope to have a great jail with the best services in the county and the best working environment. You know, we're going to have re-entry program, and that's probably among the most important functions that jail provides, other than physical security of detaining those charged with criminal offenses or convicted and serving sentences. You know, those re-entry services are key and central to the entire working process of the justice system without those re-entry services. So, you know, having specialty jobs, saying the importance of those in recruiting for those corrections officers as to the key component they serve. We still have ongoing issues, if you will, of staffing of courtrooms. And when you have an in custody defendant, correction staff can blend over into not being a bailiff, but providing security within the courtroom, and that's kind of an additional duty or a special duty that correction staff could gravitate to have court time, but also provide the benefit of having someone in uniform in the courtroom providing additional security. So, I mean, there's a lot of opportunities for corrections. And as you rebuild or build this department, I'm hoping that the relationship remains a really strong one between the Sheriff's Department and our Jail Services Department.
Well, John and I have spent the last year and a half kind of palling around for a bit, and so I believe our relationship is very strong that way. And while we were competitors, we both have mentioned to each other how important it is to work together. And so I have no concerns whatsoever with working with Sheriff-elect Horch and together making sure that this county is providing the best public safety services, whether it's enforcement efforts or jail efforts. So
That's good to hear because elections were certified yesterday. Thank you for that comment. I'm asking if there is anything else for the good of the order on the subject of the jail update, because we probably need to move on. Okay, hearing nothing, thank you very much for being with us, David Shook. We appreciate it. Council, there are 6 items of new business, and that would be the next logical break if we were not to take a break now, but later. We've got a lot of business ahead of us today. So would you prefer to take it after those 6 items of new business, just a 5-minute break? Okay, how about now? I'm seeing 2 thumbs. I'm not seeing more. Either way.
I'm hoping
Okay.
to just drive on as far as we can go, especially if there's staff ready to present.
I say keep going.
Could be. I'm sorry, I did see 3. So we're going to go ahead and take a 5-minute break right now. It is 10:10. I will see you back promptly at 10:15. Thank you. And we are continuing with our council time agenda on Wednesday, November 30, 2022. We move to new business, item 4.1, a very important topic, Columbia River Mental Health Opioid Treatment Program. And I don't know whether to call on Kevin Fisher or Sarah Brown on this, but whomever, please introduce yourself and take it away.
Yeah, good morning, Council. I'm Dr. Kevin Fisher at Columbia River Mental Health Services, speaking on behalf of the agency and Sarah Brown. I appreciate the opportunity to speak with you folks. We are currently busting at the seams in order to meet a surging need for opiate addiction treatment in Clark County. And so the purpose of my visit with you today is to discuss us moving, and that's a statutory requirement. I wonder if we can scroll through the slides there, or allow me to share. That'll work. So we're at our baseline. We are an 80-year-old startup, and we've been in Clark County for approaching a century, and we're a community mental health center with our primary location at Fourth Plain and Andreessen, and also locations in Hazeldale and Battleground. We're also providing mobile services out in homeless encampments, providing physical health care as well as assessments for addiction and mental health, and providing nighttime crisis services as well. And so many of the clients that we serve and help move into recovery and into housing and such are some of those that are most visible right now in our community. Next slide. And so one of our missions is to operate an opiate treatment program, and opiate treatment programs are specially state and federally licensed clinics to treat opiate addictions with opioids. And we have 2 of those in Clark County. We have North Star, which Columbia River operates, and then Acadia operates a treatment center over in the Salmon Creek area across the street from Chuck's. And so we are the only 2 clinics that can offer methadone in the treatment of opiate addiction. Go ahead, next slide. And so today I'm gonna talk just for a little bit about the fentanyl crisis and how it's washing over Clark County and what the implication there is, and why the value of opiate treatment programs is specific to that crisis. And then we'll talk a little bit about our new location. Next slide. All right, next slide. So over the last 20 years nationally, our drug addiction deaths have soared from 20,000 back in 2000 up to 100,000 drug overdose deaths per year. So that's a 500% increase over 20 years nationally. And most of those deaths lately are related to opioids. So 75,000 opioid deaths. And nationally, 6 out of every 7 of those deaths is from fentanyl. Fentanyl is the black line on that slide. And you'll notice that for the rest of the US, that line really started to take off in 2015. And fentanyl is fairly new to Clark County. Go ahead, next slide. And so 75,000 deaths, what does that look like? Currently, we lose about 37,000 people to motor vehicle crashes, 45,000 people a year to suicide. Breast, prostate, and colorectal cancer all have fewer deaths than opiate overdoses. The entire Vietnam War is exceeded by the number of opiate overdose deaths we have each year. And so we really are losing a generation each and every year. Next slide. And so what is fentanyl? It's a synthetic opioid. It's man-made. If you ever had a colonoscopy or a surgery, you've probably received fentanyl in that perioperative period. But it also is very easy to make in illicit labs. Right now, the DEA tells us that most of those are in Mexico, and they're using chemicals brought in from China and produced into a very compact powder that is highly potent, more than 100 times stronger than morphine. And in Clark County, most of it is consumed in the form of stamped pills that are counterfeit. They look like oxycodone 30 milligram tablets. And the DEA tells us that about 40% of those contain a lethal dose of fentanyl. And so not necessarily my patient, but my daughter, who's 12, or a high schooler ingesting a fentanyl pill for the very first time has a 40% chance of that being a lethal event. So this is a big deal in Clark County and locally. Next slide. So about a year ago, our health department declared a public health emergency related to fentanyl. And in our Columbian slide on the right, that red line is the number of fentanyl deaths in Clark County. And in 2018, we had 10 deaths. And in 2021, we had approximately 50. So we've had a 500% increase in our fentanyl deaths. And the black line on the top of that slide is total drug overdose deaths in Clark County. And so you see that those have increased significantly as fentanyl moved into our community. In the last 18 months, fentanyl has become the opioid of choice on our streets. And so heroin has really receded into the background. It's harder to find for our patients. And so folks are really forced into fentanyl. And our patients tell us it costs about $3 a pill. What did you pay for your latte this morning? And so for a very little amount of money, somebody can harm themselves significantly. Next slide, please. And unfortunately, this trend is here to stay. It's not going to go away. Heroin logistics are quite complicated. You have to, if you're a cartel, you have to have thousands of acres of farmland under your control. You're thinking about irrigation and pesticides. You have to have farmers to harvest all of that poppy, and then you've got to transport it and convert it into big bulky packages that you have to get across the border. Whereas fentanyl is a very concentrated powder. It's quick and easy to make in an illicit lab, and very easy to smuggle. And so 250 kilograms of heroin, which is about the size of a dishwasher in your kitchen, is equal to about 1 kilo or a thermos of fentanyl. And so it's much easier to smuggle this across the border than it is a dishwasher. And so these business logistics really tell us that, much like the rest of the country, fentanyl is here to stay. Next slide. And so what we're seeing in the treatment community with this fentanyl surge is that it's harder to treat for when people are ready for treatment. It's harder for them to get sober. We use generic Suboxone when we can, but patients report that it doesn't work for them. It doesn't feel strong enough. It's much more complicated to start a person on that treatment. And thankfully, we're seeing that methadone is still quite effective with this. And I can tell you that our flow of new patients went from 5 a month of July of 2019 to over 50 a month now. And so we've seen 1,000% increase in terms of demand for demand for new services. And fentanyl is really driving a lot of this. Also, fentanyl causes some changes in the body, and when somebody's in fentanyl withdrawal, their body is filled with stress hormones, and it's very hard to be nice to people around you when you're filled with stress hormones. And so what we experience is a lot more disruption in our milieu and lobbies, threats of violence, actual violence. And so this drug not only makes it more challenging to treat the individual, but it makes the individual more challenging to work with. Next slide. Next slide. And so, our approach at North Star is to treat addiction as a chronic disease of the brain. And I think about it a lot in terms of an analogy of type 2 diabetes. There's periods where the disease gets better. There's periods where it gets worse. And you try to work with the person over time in order to help them move towards their goals. And so just like a type 2 diabetic having a heart attack doesn't mean that person is a failure. We look at folks that have addictive disorders, and when they have a relapse or a slip, that is not an endorsement that they are either a bad person or that their treatment is failing. It's a feature of the disease. It's a feature of the illness. And when we work with people that way, we're able to have a much more firm foundation and have much more successful outcomes. Next slide. And so as an opiate treatment program, I think methadone clinics carry a stigma and a derogatory, and you hear, oh, that's just one drug for another. But what I want you to understand is these are comprehensive treatment services. And so we offer all 3 FDA approved medications for opiate addiction. We have one-on-one counseling in groups. We offer psychiatry services as well as mental health counseling, case management around transportation, housing, and employment. We have peers in our milieu. We treat hepatitis C as well as offer some primary care services. We put Narcan in the hands of everybody that comes into our clinic, and so that is the medicine that reverses overdoses. And also we have great relationships with our county health department, our county jail, and our inpatient treatment program partners over at Lifeline. This really is a comprehensive treatment experience that allows people to recover. Next slide. And so these medications work very simply. They're long-acting opioids, so that means that they are slow on and slow off. And that is as opposed to fentanyl, which is fast on and fast off. And so the slower a medication enters and leaves your body, the less euphoria is experienced. And so basically the goal of these medications is to help the individual's brain feel normal. And so while it feels normal, they can then go about working on the tasks that help them move into recovery. And that frequently includes acquiring housing, acquiring employment, taking care of deferred medical issues. And so these medicines are really showing that they're critical to help people move out of that transition. Next slide. Yeah, so why do we use these medicines? And the reason we use them is because they're more effective than anything else we have to offer. And so compared to usual care, including use of these medicines reduces overdose deaths significantly, as well as fewer HIV and hepatitis C infections. It means fewer people in our hospitals with valve infections of their heart. It means moms having good pregnancy outcomes, and it means fewer crimes committed in our communities. Next slide. So bottom line is in the face of this fentanyl epidemic, we have outgrown our treatment services and our space. We have expanded our hours. We've made walk-in available Monday through Friday. So a patient can wake up at 7 in the morning and say, I am going to start treatment today. And they can come to Columbia River and make it happen that day. And so those two models, the expanded hours and walk-in availability, have really made a difference and an impact in our community and our ability to get people into treatment. And our census has doubled from 300 to 600 in roughly 3 years, in part because of those changes. And I can tell you that our lobby is a madhouse right now with new patients seeking treatment, and we're up for the challenge. Next slide. Yeah, so our new location, you may know it as the Elmer's Restaurant. It's on, it's off of Andreessen and SR 500, and it's going to be an 8,000 square foot facility with approximately 18 treatment rooms. We're going to improve the privacy experience for our patients and have a lab on site to support medical services that this population of folks clearly needs. And it's centrally located bus lines as well as our 3 major freeways. Next slide. All right, well, that is my statutory required announcement and a little bit about the fentanyl crisis. I'm happy to answer any questions, but otherwise I want to thank you for your hard work and service for the county and its residents. My family's been here for 80 years and I wouldn't live anywhere else.
Questions
Chair?
from council
May I?
or comments?
Yes, ma'am.
Go ahead, Councilor Wilder.
I guess, how do you define success in treatment, and do you have any comparison of how your program compares to others, either regionally or across the country? My sense, and please correct me if I'm wrong, is that this is not only a growing problem of significance, but it's one that it's hard to get positive outcomes. How often do you actually get people that completely separate from their addiction, from their medications, that actually reintegrate into society? My perception is it's a very tiny percent, and that we are doing everything possible to help, but it's not necessarily a real positive long-term view. Please correct me if I'm wrong.
Yeah, I would like to. So I would say that combining all treatment approaches, there are millions walking among us that are in a various stage of recovery from a use disorder, be it alcohol, tobacco, or opiates or methamphetamine. And that there is no one right way to help somebody into recovery. And in terms of what does success mean, I leave that up to the patient in terms of what their goal is for being in treatment. And most patients want to move into sobriety and really stabilize their life. So the average North Star patient, new patient coming in, has their possessions in a bag. And is generally living in a tent or in their car or some similar unstable housing situation and not working in employment. That is kind of the foundation that we start with. And we have success story after success story of individuals moving into recovery, generally over time, not overnight, but in weeks and months. And those individuals get housing, they get jobs, and they get stable lives. And so a patient at North Star who's been with us for a few years in general looks like a mom taking care of her children and being reliable in that way. It looks like a business owner operating a construction firm. It looks like a person working in the trades and showing up reliably and being a leader on their crew. We see these heartwarming success stories, and working in this job now for 4 years, what it has taught me is to never say never. Because at North Star, we see really the hardest cases that Clark County has to offer. And really this program can work for anyone as long as they're willing to do a few simple things. And so I would say that this is a chronic illness that is more visible to us because of the homeless situation right now up and down the West Coast. And that situation is probably somewhat driven by these very inexpensive drugs. And so methamphetamine and fentanyl have become very inexpensive, which unfortunately makes it a lot more easy and accessible for people to enter into this lifestyle and use disorder. So, but we have to have treatment centers in order to turn that around.
Madam
The
Chair, I
drug
had some
industry that manufactured or manufacturers, I guess I should say, opioids, has been forced to pay millions and millions of dollars for use in dealing with all of this. How have those funds affected you, and how do you anticipate them affecting you in the future?
So right now, the state is going through a decision process on how best to distribute those funds. We do have opiate treatment programs at the table in that discussion. I think it remains to be seen. I believe the state has funded some mobile treatment services out of those funds thus far. That's not something we've explored yet at North Star. Our focus has been expanding at our footprint as well as our work at the county jail. And so I think that it remains to be seen, and it's a situation that has not yet kind of reached its conclusion with those work groups.
Madam
Other
Chair.
questions or comments from council?
So thank you, Doctor. I appreciate this presentation, and we need more of it. I understand that Washington State is not among the top states in providing addiction services compared with other states, and that's disappointing. I would like to see that change. Your program is just what we need, and we need more of it. What I want to focus on is, whether it's methamphetamine, cocaine, fentanyl, heroin, it's a scourge. And I know that our legislature is going to be taking up the issue. I have no optimism they're going to deal with it correctly. Having experience in the criminal justice field with that population that really needs involuntary treatment. We had leverage through the criminal justice system for sales, possession for sales, unlawful possession of dangerous drugs to provide treatment. We had the leverage to provide treatment instead of incarceration. With the decriminalization of drugs, especially dangerous drugs, the criminal justice system lost that leverage. So that's going to get me to the point, and you kind of mentioned it with the homeless population. We've been trying to focus the county on outreach for our homeless population and those that are mentally ill and addicted, perhaps have a dual diagnosis of both, and bringing services to them. We have tripled the number of outreach capability in the county in the last few years to get to those encampments, to bring help, offer help to those who are addicted or mentally ill or both. But the next step, so we need to continue on that path with outreach and especially with your type of services. But the next step, and it's starting to grab hold elsewhere, not yet in Washington State. I just read in the paper today about New York, but I've been tracking what California is doing. And they're expanding their involuntary treatment for those that have no impulse control, their brain is damaged, that have no understanding of their addiction or their mental health, and they're just dying on our streets. California has now just passed a law to provide involuntary treatment. New York's going to do the same thing. And we'll see how that progresses. But I think that's the next step for Washington State, to pay more attention to providing involuntarily those services you now provide. So I'm hoping you will position yourself with that thought in mind, because resources are going to be the main issue. Where do we have that additional bed space? Where do we get those additional outreach workers? You know, where do we get the resources and the bed space and the service providers like yourself that are trained and capable of providing all the mental health and drug treatment to wean people off drugs so they can heal their brain? So what are you looking forward to as far as expanding outreach services? I know you've expanded your hours and you're going to expand your capacity. What are you looking for down the road?
Yeah, I want to echo what you said. Law enforcement absolutely matters. Our county sheriff's department made a major fentanyl bust about 4 weeks ago where they disrupted a pill press that was operating in our community. And I can tell you that we saw a surge of new patients because of that disruption to the drug supply. And I am sympathetic to the idea that we've lost in some way a major lever to help people into treatment. It's not a problem I can solve, but I'm supportive of that idea. And currently what we're doing is with our mobile health team, we are out in homeless encampments and engaging with a peer as well as a physician assistant, a nurse, and a mental health and addiction counselor. And through the use of that peer, we really form a relationship and familiarity. And then we do assessments of individuals when they get ready for treatment, whether that's treatment for addiction or treatment for their mental health issues or both. And then we kind of coordinate to get those individuals back into our major footprint. What's next in addition to that? I would defer to my CEO and to our board as we kind of set the next strategy. We're about a year into that mobile effort, and it's gone, I would say, quite well, and we're very happy with it. And all I can say is, if we could afford it, we could probably make 5 of those teams and still fill their time. So, yeah. I hope that answers your question.
Thank you very much, Doctor.
Other questions and comments?
Madam Chair?
Yes, Councilor Rylander.
So just as the wrong time to do this, but I would personally be interested in learning more about what's causing the number of people to want to consume substances, and how do you identify those people early so that we can perhaps take some sort of educational or preventive effort? I don't want you to go into it right now, but I'd just be interested in learning about that on the side.
Yeah, I do have a longer talk that gets into the science of addiction and what's going on in the body in the brain that causes this that we're all witnessing. And I'm happy to provide it to your council at any time.
Madam Chair?
Yes, Councilor.
Yeah, that particular topic might be a good Board of Health topic. We've had opioid conversations over the years with regard to the epidemic and Clark County and et cetera. So maybe in the future, we can invite Dr. Fisher back and have that presentation or conversation in a Board of Health meeting.
Good idea. About how long is the presentation, Dr. Fisher?
The standard presentation is an hour, but I can definitely adjust it downward to meet the needs of your group.
Okay, thank you. That sounds terrific. Other comments? I'm sure we could go on for a long time, but it is time to move on. And thank you very, very much for being with us today. It's super informative.
Thank you. It's been an honor.
We wish you well. We move now to 4.2, the Public Authority Letter of Acknowledgement regarding the National Tribal Transportation Facility Inventory.
Ken, are you going to present this morning, or would you like me to?
I'm happy to give this a shot, Kathleen. Thank you.
Thank you. Thank you.
Bear with my voice, and I'll try not to cough in your ears this morning. But today we have a public authority letter of acknowledgement from you, coming from a coordination effort that I've had with the Public Works Director of the Cowlitz Tribe, Dean Reynolds. He may be on the phone lines today, but I know he had a conflict. So This is just a request of acknowledgement, a coordination with the tribe, and I'll go ahead and read it into the record. The Cowlitz tribe has identified portions of Clark County's roadway system listed on the attached table and maps that it wishes to add to the National Tribal Transportation Facility Inventory, the NTTFI. The roads are crucial to the tribe's access to goods and services, existing and potential economic development, and emergency evacuation and response. Tribal members use the roads for daily living needs to include, but not exclusive of, access to schools, employment, mail, shopping, healthcare, and traditional and recreational activities. Clark County is responsible for the maintenance of the sections of road that they own. The county has sufficient funds to meet current and future maintenance needs. The roads are open to the public and will remain open to the public if they are added to the NTTFI. Approving this letter and allowing the tribe to include these roads on the NTTFI simply opens up funding for the future roadway improvement projects. The tribe will not receive any additional funding as a result of these roads being added to the NTTFI, but it will open avenues of funding not otherwise available to the county and state for road improvement. In no way does this action impact the county's authority over the subject roads. Clark County understands the importance of these roads to the Cowlitz tribe and is aware that the roads may need improvement at present and in the future to maintain public safety. If the tribe, after approval from and project coordination with the county, does perform roadway designs or improvements, county agrees to maintain those improved sections of road with available funds without any regard to the roads being on the NTTFI. Therefore, in accordance with 25 CFR Part 170, the Cowlitz tribe, in conjunction with Clark County, is requesting that the BIA accept the roads into the NTTFI. And I'm happy to answer questions about this, but the additional attachments show the roads that we're considering adding to the inventory. And it's the section of North Royal Road that comes out of Ridgefield and then extends to Northwest 31st Avenue on up to the tribal boundary. So, can I answer any questions?
Madam Chair, I do have a couple of questions.
Go ahead, Councilor Rylander.
So again, two questions. One, is there, because this is, abutting Ridgefield, is there any feedback from the city of Ridgefield at all, and particularly any future expansion plans? Would there be any impact? That's question number one. And I guess the other question is there a downside to either the city of Ridgefield or Clark County or the citizenry of Clark County to approve this?
Yeah, thank you, Councilor Rylander. Good questions. For your first question, I know that Dean is also coordinating with the city of Ridgefield on a similar letter of acknowledgement. I don't know the status of that, especially because there are segments actually of this road that are split up by the city of Ridgefield, regardless of whether there's an expansion of the boundary. It already kind of sections out these two segments that you see on the maps. So and then in leading into your other question, I don't know of any downside, and contrary to that, this would make available funding through the NTTFI. By the roads being on the inventory, it does open up potential funding for work to be done to possibly improve or maintain these roads. And that's something that we could enter into partnership with the tribe if that comes up in the future. I'd also add that in order to qualify for the inventory, these roads need to be within 15 miles of the tribe. And so there may be future opportunities and other roads that the tribe identifies that they reach out to us with future requests to add to the inventory.
Thank you. I guess my only concern is should we be making a decision or recommendation without knowing what the city of Ridgefield is saying or may weigh in or not? Should we get their input before we ultimately make a call or a suggestion or a comment?
We certainly could, and I would just say that funds that may come available in the future as a result of this wouldn't be contingent on what may or may not be on the list for the city of Ridgefield and their activities. But absolutely, we would want to coordinate with them, and I can follow up with Dean Reynolds to see if he's had any progress on that. I will say. I want to acknowledge Dean and the tribe for their patience on this. This request came in over a year ago, and through our many iterations of county engineers has fallen by the wayside. So we're happy to have it before you today, and I would recommend us approving the letter for the acknowledgement if the council is willing to do that today.
And I do see Dean Reynolds is on with his hand raised. So Dean, if you want to provide any feedback or insight, if you can go ahead and unmute yourself, and if you can't, we can do that for you.
Thank you. Thank you. And I appreciate the time to speak to you. Yes, we are in the process with the city of Ridgefield. They are bringing their MOU forward to their December 15th council meeting to vote on. And they're very encouraged about getting it signed into our inventory.
Have they indicated one way or the other whether they're supportive or not?
Talking to Steve Stewart, they're very supportive. They wanted
I just don't want to.
Go ahead, sorry.
I just don't want to step on them if they have an issue or a challenge because they're so close. That's my only concern.
Madam Chair?
Yes, Councilor Medvigi?
Yeah, so I think I disagree with my colleague to my left. I don't see this as an issue that we should follow Richfield on, and it sounds like there is no objection that we're aware of. They would have perhaps reached out to us. I think, especially with the time it's already taken to get to this point, we should move with alacrity and approve this. If there was a downside, I would have expected Ken to address that with us, or untoward obligations that don't seem to exist. So I think we should support this letter and approve it today.
And if I could just ask Ken really quick, just for clarification, the road that's being included or being requested to be included is the responsibility of the county. It's our road. And so, okay, so we are responsible fully to maintain and develop everything that we need to do with the road. And so just to reiterate what Ken's already shared is this letter doesn't bind us in any way. It literally just opens up additional funding resources to pay for any improvements or maintenance on that road.
That's correct.
Madam Chair, would you need a motion?
Go ahead, Ken. Julie.
So would you need a motion? Do we need to approve this, or is this
At some point, yes. Is there any further discussion, Kathleen or Ken?
I think the only thing I would add is I think we just need a head nod from council on supporting this. We don't need an official motion. And then if council is supportive, do you want have the chair sign it, have the full council sign it, or myself, or, this isn't a requirement from council on this, but of course we want to be transparent and continue to put things before you.
So I gave a thumbs up, and I have no care whether the manager or chair sign it.
And I was just getting ready to ask how many thumbs up are there? I see 3 or 4, so that is good. And as far as who signs it, let's just get it done. I'd be happy to help, or you could go ahead, Kathleen, unless somebody has a preference on that. Okay, very good. Thank you so much, Ken.
Yes, thank you, councilors.
The 4.3 item is 2021 traffic impact fee report.
And before Mark gets started, I'm happy to share that we just found a little extra time for council this morning because 4.3 and 4.4 are apparently the same agenda item that Mark will be presenting this morning.
Good.
Good morning again, Council. Mark Gasway, Clark County Finance Director. A week or so ago, we sent out an email with this report. However, we are formally bringing it before the council for your consideration, certainly to answer any questions that may be available. Each year we produce a impact fee report that includes both traffic impact fees and park impact fees. And we evaluate the concurrency aspect of those fees. This particular report, as I mentioned in my email to you, is a little bit late. Typically, we have this done with during the summertime when our other reports are presented. However, we wanted to verify some records with the Public Works Department, and there's been some changes there, so it took a little while to get through that process. However, now we are comfortable with where we're at with this report, and it's here for your consideration. So if you have any questions about it, I'm here to answer those questions.
Could we please look at page 13 of 13 on the item that was to be 4.4? For whatever reason, I had written there that I did have questions, but I can't remember what they were. Oh, yes, indeed. So is this item relevant at this point, Mark?
Yes, yes.
Okay.
This is the impact fee report. It's the same.
Okay, very good. So if I'm comparing the bottom part, the summary of facilities and capital assets on which the fee description of expenses is there with the numbers that are above, in some cases, I'm not reconciling them well. For example, look at Ridgefield. The expenditures are shown as over 712, and yet it states no report provided. But what is this schedule actually telling us?
So what this particular schedule tells you, this is, again, as it says, this is the school districts, and we're able to track the fees because the impact fees are received through the treasurer's office. So we're able to look at this activity. And then we reach out to the school districts and ask them to comment on the particular expenditure portion of these. So if by the time we complete the report, if they have not provided any information to us, we certainly don't put anything in for them. So in the case of Ridgefield, they did not provide us any additional information to talk about how they use their expenditures during this time period in 2021.
Is there a requirement that they inform the public on that?
You know, we would hope they would want to be as informative as possible, but you know, sometimes things either slip through or they just don't have the resources to respond. So
all the cables are in the back and it's very hard to see if it's connected.
Other questions or comments?
One other comment on this particular schedule, just so you know, school years, their fiscal year is different than the county. So you'll see that the dates on this are from September through August, rather than our own funds would be a calendar year. So there's a little bit of difference in how some of this information is collected. So.
Comments from council? Questions for Mark? Is there any action required on these items?
No, this is just a presentation for, again, to comply with the ordinances, but also for your information so that you have this available. And again, if there were any concern or anything that I felt we needed to point out, I would point that out in the body of the report itself. However, I believe that the report is in good shape right now. We're not in a position of concurrency with any of our impact fee funds. So.
Okay, anything from council at all? And hearing nothing, I believe we may move forward. Thank you, Mark.
Absolutely.
So we move to sales tax leakage, item 4.5.
So this again is, Mark had sent some information on the sales tax leakage, and I think we have the retail sales tax distribution and population for the last couple of years. And so, Mark, if you could just provide a high-level overview of this and answer any questions council has.
Absolutely, yes. So following up on a request from council a couple of years ago, we looked to document what we felt the sales tax leakage would be for Clark County due to our border proximity to the state of Oregon. And at that time, and yeah, I believe this is the 2019 amount. Can you scroll down, I believe? Yes. So this basically gave us a perspective of where we felt we were compared to the other counties. And I'm looking at this particular spreadsheet. Is there one that I sent out that shows the 2021 as well? There was another document.
Yeah.
No, that's the public safety sales tax. That was earlier.
Yes, we'll get it. It's right there on the right.
There we go. Okay. So I updated this. No.
That's 2019,
Yeah,
I believe.
2019 again.
Yeah.
Yeah.
The one that says per capita sales tax 2022
Yeah,
on my screen, it's the third.
Yeah.
There you go, that one. Yes. You're good, thank you.
There we go. Okay. So what I wanted to do is update this, and then I compared it to where we were at in 2022 based on 2021 data. So if you scroll over to the right a little bit, I have a couple of comments right there. Okay, so right now, if you look at the Clark County sales tax per capita, and again, this is not a scientific methodology, it's just the amount of sales tax per capita. We are 19th out of the 39. That is actually a little bit of an improvement from where we were 2 years ago. 2 years ago, we were about 20th out of 39 counties. Out of the large counties, as this shows you, we are ranked 8th in sales tax per capita out of the 10 large counties. Again, that is a little bit of an improvement from where we were 2 years ago. We were 9th. We were ranked 9th. The range that I've calculated for sales tax leakage or the loss has narrowed, and actually it's decreased. In the latest analysis, our range of sales tax loss is somewhere between 2.1 and 5.9 million, whereas 2 years ago in the same analysis, it was somewhere between 2.7 and 8.7 million. So you can see that both of those, the base or the low and the high have both declined, as well as the range has decreased. So, and I would attribute this most likely to the online shopping, you know, the ability to receive sales tax directly because of our destination-based sales tax laws. So again, this was done as a follow-up, a request from council. And again, if you have questions on this, it's not a scientific study. However, it is, I think, a pretty good indicator of where the county is compared to other counties in our state. So.
Questions, comments?
So I do right away. Mark, thanks for continuing with this. I somewhat stopped beating this drum when we saw our sales tax increase dramatically. It was hard in that context, you know, not knowing whether or not problem solved by the pandemic and people shopping more online instead of crossing the river, or how much we still could be losing and how much more sales tax we would have been gaining on top of that 40% increase roughly that we saw. So this is important work, and I will tell you that I did forward your slides to our legislative delegates to keep their interest and at least keep their visibility of this ongoing issue. I mean, it's a statewide taxing issue to kind of do something different for the border counties and especially ours, which is very dissimilarly situated. We're the most impacted. The question I have though is, so based on this current analysis that you've done, and I know other have used similar models to try to estimate or forecast what tax leakage or could be. By saying in the bottom line, we are 5.3% below an average for large counties. Is that your best estimate as to where we're at today in light of the changed shopping that we've seen during the pandemic?
Yeah, according to this analysis, yes. That would be probably the best number. Again, it's probably somewhere in a range. We don't have exact data, but you know, right. 5% below the large, again, this is comparing the large counties. And there's a little note on there that says without King County is so large, it just distorts everything. So that 5% would exclude the huge numbers that King County provides. You can see their sales per capita is way ahead of everyone else. So it's kind of an outlier. So I've excluded that in that 5.3%.
Okay, understand. Thank you. And thanks for the continuing work. I think we need to keep sight of this, especially if the state does progress in really looking at a different means of taxing its citizens. I mean, we have to some extent asked our local citizens to buy locally, you know, to go to our local shops or buy online. But, you know, human nature, what it is, it's hard to ask people, yeah, please pay more sales tax instead of crossing over the river and into the Portland shopping mecca without sales tax. So I appreciate this work. These are solid numbers in my estimation.
Madam Chair?
Yes, Councilor.
So Mark, if we could pull out the crystal ball, would it be unreasonable to suggest that the upside potential for more sales tax, people buying locally, will increase as fuel prices continue to be high, and the potential for tolling into the Portland market, because any of those situations reduce the value of crossing over the river? And on top of that, if for some reason we were able to move some of those 70,000 plus jobs back onto the Washington side, that would increase revenue. So I'm looking at the potential from a longer term aspect, that there is still some upside just because of the economics, the way they're playing out, make it less profitable to drive and spend time in Oregon to make purchases. Is that an unreasonable expectation?
No, I think those are certainly reasonable expectations. I think that we only have the 2 years, the 2 data points really, the trend is down. You know, the impact, the major impact during that time period was COVID, where people began working more remote. So their, you know, shopping choices probably became more local. I haven't conducted a study to prove that. We just have to look at those outside influences. If we had, you know, major new outside influences like tolling on bridges or whatever that might be, certainly we want to update this and look at those data points and see where that, what direction this is trending. I guess I would, make the comment, at some point in years past, we felt that this was a much larger number, significantly larger, 10, 15% or even more. I think these last two, the last two analysis have shown that we have maybe not as big a problem as we may have thought, but there certainly is a significant amount, another $5 million into the general fund would be a significant amount of relief for that fund. So.
Yeah, and just to tag off of that, and mainly for Dick and the public's benefit, those numbers years ago that we had talked about looked like about $250 million over about a 10-year time period that we probably lost out of because of the amount of taxes that we send to Olympia instead of retain locally, and people shopping across the river. So it was a huge amount that would have really impressed the county manager and made her budget easier if we didn't have that leakage issue.
That destination sales tax ruling that came about how many years ago? 3 or 4 years ago?
It's been maybe a little longer than that now, probably right before the pandemic, maybe 2018. So.
Well, that was just a brilliant move on the legislature's part, even though they probably did not anticipate these numbers at that time. And I just think, that was pretty much happenstance for the effect that is rather profound that it has had on Clark County. And I just wonder what else is in the offing that could be done that could have a similar profound effect that we could help make happen in a purposeful kind of way. And if we could come up with those things clearly, those would be wonderful priorities for this council for next year. I know, put in tolls, right?
I don't know.
No.
Do we still have a significant issue with people registering cars out of state but living in state, or has that really dropped down dramatically?
I know that the Washington State Patrol has a vehicle enforcement, program. We don't really track that. Whenever anyone comes over to get a new driver's license, there's certainly efforts made to make sure that licensing is transferred. We don't have an enforcement. The county doesn't enforce that though. So it's a state
Very
issue.
interesting. Very interesting point. Why don't we enforce that?
It's a state issue. It's not a
Yeah,
county.
and we can look into it, but if I remember correctly, the state changed how licenses were and the cost for that. So it's no longer the low fixed rate that it used to be. So it may have reduced some of that impact that we were seeing before, but we can at least see what the current charges are.
Well, we live not terribly far from the bridge, and we see a lot of people using the bridge who have just come from a Washington residence with their Oregon license tag. So it clearly still occurs to some extent anyway.
One of the, I think, rulings that has helped as well, it used to be when Oregon shoppers would come over, they were able to show identification and immediately suspend sales tax. Now it's more, the law has changed so that they actually have to request a refund. So it's that may have impacted the amount of sales tax collected as well. For, you know, for small purchases, certainly people probably aren't going to go through the effort to request a refund.
Well, I hope those kinds of ideas make us think about this, because the more purposeful things we could do to make this even better, it would be wonderful and well justified. I mean, when you look at these data, 19th out of 39, it would be well justified for us to be doing that. Well, other comments from council? Okay, thank you, Mark, for compiling and sharing and analyzing the data.
Sure.
Item 4.6, Counselor Manager Goals.
Thank you. So staff, if you can pull up the vision, mission, and strategic actions document first. And okay, thank you. So for anybody who's watching or interested, this is actually the county's vision, mission, and strategic actions. It is posted online on the county manager website. This was effective in 2016. I believe it was a year-long or more process that involved the county manager, the directors, and all the separate elected officials. And so this really does provide the framework in which we strive to do to provide the best services in the most efficient way in the county. So I just wanted to bring this up. This identifies our vision, the mission, when providing the services, what we're going to provide them with, such as collaboration, innovation, accountability, et cetera. And staff, if you could scroll down just a little bit. Additionally, the strategic actions are listed here in different categories, such as community relationships, customer service, decision-making process, employee relations, finance, and technology. So again, this really does define parameters and how we do our business and how we strive to do our business. We can always do better and strive for better. I first wanted to bring this up to make sure everybody knows that this is adopted. This is work that we have been doing informally in the past and in collaboration with the council over the last month or so. I will now be presenting county manager goals that we have been discussing, which are in line with all of these strategic actions. And what this does is help us get more definitive and more intentional, both with my work, but also all the employees who support me. So if you can pull up the county manager goals. And again, this is a draft, and this has been a great process to go through with the council. Again, a lot of collaboration and agreement and ensuring that we are supporting our residents the best that we can. So as you can see, it is just the introductory paragraph at the top just identifies the vision, mission, and strategic actions, and the link is there as well. This draft is also posted on our website with regards to today's meetings. And actually, moving forward, I can also include this on the county manager website as well once it's finalized. So the first area on here is community relations. And again, a lot of this is pulling out the verbiage that was already agreed upon. This is really looking at maintaining, expanding intentional internal and external partnerships and leverage relationships. These relationships are key. Our staff are key stakeholders, our separate electeds are key stakeholders, the cities and other organizations, and even community is really important because that's why we're here. And so I certainly don't know everything, and I appreciate the relationships that I have developed, and I look forward to those that will be developed in the next year. If we could scroll down just a little bit. The second item here is customer service, which was the second strategic action. So this is really about supporting and developing business processes, respecting and operating with consistency, innovation, looking at ways to track questions and concerns that are coming forward and use that data not only for responses, but to look for notable trends so that we can help steer a direction. And we've been doing a lot of great work and looking at the data to help push recommendations moving forward. We're working on consistency and always looking at ways to do better. Permit Center is a great example. They have, gone through their permitting process and really streamlined that. So just continually looking at those processes that have the direct impact to our customers and looking at ways we can do it better moving forward. The third one is the decision-making process, which is really going to be an intentional work this year, which is aligning the department and council strategic, operational, and policy goals within this framework, and looking at creating dashboards with specific operational and policy goals, the key milestones, the data, what's working, what's not working. So one, it holds us individually accountable, but also is transparent to the community. So when we're working on something, developing a new process, developing a new program, letting the customers know where we at, what's working, what's not working, and so that we can review that on an ongoing basis moving forward. The fourth one is employee relations. This is huge because this is our people, and our employees are our number one asset. We want to make sure that we're supporting a workplace where people want to come, and that Clark County is an employer of choice. And we want to retain our employees, let them know that they're valued, that they're supported for success, they have a clear understanding on what is expected, and they have the tools and training to do their work. I mean, this is important, and having that ongoing continuous feedback, which can be hard for some because we want to be able to provide feedback where employees are motivated to do better and not necessarily upset that they have the conversation. So how can we collaborate and build up the personnel that we have, give them the tools so that they can continue to support the community. The fifth one is finance. And council has recently seen where we have been developing finance policies over the last year or two, and we're going to continue doing that with our major funds to ensure that we have that operational continuity if something unexpected like COVID hits, that we have the 60 days or whatever we need to ensure operations continue during unexpected timeframes. And of course, our capital plan that we're working on. We talk budget's the number one topic right now, but it is discussed weekly with the finance team throughout the year. So we want to continue to do that and also develop those 6-year forecasts, which most of them are done. We're still working on a couple. The capital budgeting program, which we've never had before here, that really does set the tone and the financial strategic plan for us moving forward. And finally, technology, utilizing technology to improve our service. And then also just for me professionally, there's a lot of things I don't know, and I appreciate the staff and everybody supporting me and teaching me over the last 2 years. And I know there's a lot more to learn, such as the Growth Management Act and comprehensive planning. Oliver is a tremendous asset, and he kindly reminds me monthly at least that this is coming up and it's really important work, and we're going to be partnered over the next couple of years to get through that. And utilizing our associations that we can. We have a good network. I do meet with the city managers. We have WASAC, we have ICMA, we've got the specific areas that provide additional support, information, examples, etc. So that is just an overview, again, for the community. This document and the specific information is online. I do want to, again, say thank you to the council. The council has been very collaborative, provided great feedback, and we're all on the same page on how to move forward. But I would open it up to council if there's any specific questions that you have on this.
Just a comment,
Madam Chair.
Kathleen, that would be number one, thank you for tying this directly, as you have done, to the vision, mission, and strategic actions of the county, because I, for one, was not aware until last year that the county even had a statement like that. And to highlight it and use it because it is so well done is really terrific. In addition, I'd like to thank you for your constant work in all of these areas, which I know I see from my vantage point all of the time with your work. And thank you for doing that and for highlighting it here as something to make it measurable for which you're accountable, because all of that is terrific. Are there other comments from council on the goals?
Madam Chair?
Yes, Councilor Rylander.
So I would just like to point out that I think it's excellent that the county manager has a set of goals that will carry forward for the coming years. Excellent value for incoming council as well to see what the goals and the objectives are so that they can then ask pertinent questions, gather information, give additional feedback and guidance and suggestion. Great for the public to be able to see how your goals tie in with the county's overall strategic. So I think the entire process has value for anybody in the public that wants to actually get a better handle on what the efforts are and how to actually determine whether or not they believe the goals are being achieved and the success. So it gives you some opportunity for measurement. So I'm highly supportive and I appreciate the effort going forward here, and I think it will pay dividends in the future.
Madam Chair.
Yes, Councilor.
Thank you. Yeah, so Kathleen, also I'd like to say thank you for taking the time to put these together. You know, you took over at the beginning of this pandemic. You've been a steady leader over the last few years. You know, the county's moving back into kind of day-to-day regular county business as we go forward, and having this clear outline of goals that both give our staff and our community a clear vision of where you want to take the organization, I think is critically important. And with the incoming council, you're going to have 3 new councilors next year. This will be a great foundation for them to get started with and to help you achieve the goals that you've outlined today. So thanks for your leadership. And yeah, this is a great start.
Other comments?
Very briefly, I know we still have a long afternoon ahead of us. My thanks as well. I just want to emphasize that I really believe that the relationship between the executive and legislative branch is rock solid, and this document is a good working document to go forward. And to the other comments that were made, this should be part of the onboarding process. And if you've already had contact with our councilors-elect, we did certify the election results yesterday. It would be good to go ahead and email them a copy so they don't have to look and seek it out. I think it would be a good introduction to them as to your view of your role in the county.
Kathleen, would you please comment on this? At some point, council may wish to move this from draft status to approved. What is the timing for that?
Well, certainly if there's any suggested edits today, I can make that. I did find a couple things I forgot to underline, so I will be making some edits and taking the draft off. But if there's any edits, please let me know, today. And if you think of something in the next day or two, I do want to have this finalized and out as soon as we can.
And Leslie, would you please comment on the timing of that? We share that desire to have it approved and out.
Oh, I keep hitting it too many times. Apologize. Yes, it would be best if these goals could be finalized and posted today.
Did you say, Kathleen, there are a couple of other changes that you had made or wish to make And would you identify those?
Yes, if you can scroll down to number 5 and number 6. If you see it on number 4, the title is underlined. I didn't underline number 5 and number 6. So that's the edit. It's just underlining those two to provide that consistency and taking the draft off the watermark and the draft in the title. So those would be the only edits.
Those are not serious. Thank you. Are there any edits or other comments that would affect the content from council? This is, as the public can imagine, definitely not council's first time to see these. We have been working with Kathleen on the draft and seeing it as it came forward. So this is not news to us to see it right now. But are there
I do
any
have one
other things? Yes.
One other question, Madam Chair.
Yes.
Does anybody need to sign off on these, or does Kathleen just sign off, or does the council, is there anybody else who needs to acknowledge that they're adopted or accepted at all?
I don't think so. Nothing formal. I mean, certainly if there's feedback, I mean, that's important, but these are my goals, and, you know, goals to me change depending on the business, and so there would be ongoing conversations moving forward with the council if there's updates. And what I'll do on the bottom as well, I think right now it has an updated date on there. I'll put the final version, the date, and then the last date it was updated on the foot. But I think, I'm looking at Leslie, I don't think that these need a formal adoption, but certainly if there are recommended changes, we would hear that.
That is correct. No formal adoption is necessary.
Thank you.
Even though there isn't a formal adoption necessary, we might want to give a thumbs up on this, just so that it's clear that council is or is not supportive. I'd be more comfortable with that. Are you okay with that?
Yes.
Okay.
Yes.
Are we, whoops, I'm sorry, my dog sees a truck out there. Are there any other changes or edits that you wish to ask about or make? And seeing none, hearing none, is there a thumbs up on having these as the county manager goals, not a draft, but for 2023 to 25? And I believe it is unanimous. So if you would not object to recording that unanimity, I think that is a good idea. And that will conclude this part of the discussion. Yes? Question? Kathleen, is there anything else?
No, that's all. Thank you.
Okay, very good. Counselor reports, are there any? Work session requests, the agenda shows none.
That is correct.
Lindsay here, is there a report on policy issues?
Yes. Good morning, Council. Just one quick thing for you. We did receive the notice of funding opportunity from the State Department of Commerce regarding the next round of rural broadband updates, or rural broadband grants, rather. The challenge that we have with that is that there is an open access network requirement that allows for the provider to have exclusive access for 3 years. And then following that would be required to have that infrastructure be an open access network. So we just received the information, so I'll be following up with Comcast, and we'll let you know, and the other providers in the community, and we'll let you know if we have some viable potential grant opportunities depending upon their comfort level with that open access requirement. That's it.
And that has been an issue in the past, has it not?
It has. It's what blocked Clark County from receiving grants in the past, because Comcast was the only applicant and they were not comfortable with the full open access requirement that was the requirement of the first round of the grants. So this is a slight improvement, and we have some more providers that are interested in potentially partnering with Clark County. So we'll see what they say and their comfort level on this new requirement.
Questions or comments on that to Lindsay? Okay, very good. We will move into 5 executive sessions. And as I look at the numbers, I believe they total 75 minutes. The first 2 are dealing with potential litigation, RCW 42.30.110, Section 1I, one of 10 minutes, the second of 20. And then there are 2 RCW 40.30.110, Section 1B, one of 20 minutes, one of 15. And then the last item deals with collective bargaining of 10 minutes. There will be council present for all of these 5 discussions. And Leslie, is there anything else to be added?
Thank you, Chair. The only correction is that when we get down to the 3rd and 4th executive session, one of them is under 1B for 20 minutes, but then the next one is actually 1G for 15 minutes.
Thank you. Yes. Very good. Anything else? Okay, 75 minutes. Let's see where that puts us. What time would that be? It's 11:30.
I would do 12:50.
Okay.
Does that sound right? Because 1 hour would be 12:33 and then another 15 minutes. So 12:50 to get us in there and out.
Okay. So, council, we will reconvene at 12:50. And to my knowledge, will that involve any after action, Leslie?
No after action, thank you.
No after action, but we will reconvene for the purpose of dismissing council time and calling that to an end at that time. So thank you very much. And council, I'll see you in executive session in a sec.
Hello, the council is extending their executive session for 10 more minutes and will be returning at 1 p.m. Thank you. Hello, the council is extending their executive session for another 10 minutes and will be returning at 1:10. Thank you. Council is extending the executive session for another 10 minutes and will be returning at 1:20. Thank you. The council is extending executive session for 5 more minutes and will now be returning at 1:25. Thank you.
This is the end of the 5 executive sessions that we have had today following council time. And so at this point, we have come back from that council time recess to adjourn council time. And so with that, this meeting is adjourned. Thank you all for being here.